For many seniors over 80, keeping up with rapidly evolving technology and modern conveniences can feel overwhelming. While younger generations have grown up with digital devices, the internet, and smartphones, older adults often encounter these tools later in life, making learning and adaptation more challenging. Tasks that are second nature to others, online banking, using smartphones, video calls, or even navigating automated systems, can become sources of frustration, anxiety, and dependence if not approached carefully. The difficulty is not only about learning new devices but also about confidence and accessibility. Complex interfaces, small fonts, or unclear instructions can discourage seniors from using technology. Fear of making mistakes, accidentally deleting important information, or falling victim to online scams can further inhibit adoption. Even routine conveniences, such as self-checkout kiosks, automated customer service lines, or smart home devices, may feel intimidating, creating barriers to independence. This gap in technological adaptation can have significant consequences. Seniors may struggle to access essential services, including telehealth consultations, online grocery delivery, or digital communication with family. Social isolation can worsen if they are unable to participate in virtual communities or keep in touch through video calls or messaging apps. Moreover, the inability to use technology may limit access to information, entertainment, and tools that could enhance both safety and quality of life. However, adaptation is possible with patience, support, and tailored approaches. Learning at a comfortable pace, focusing on one skill at a time, and using simplified devices or interfaces can build confidence. Family members, caregivers, or local community programs often provide guidance and training, helping seniors become comfortable with essential technologies. Tutorials, step-by-step instructions, and hands-on practice make learning more effective, while reassurance and encouragement reduce anxiety. Accessibility features also play a crucial role. Voice commands, larger text settings, hearing aid-compatible devices, and screen readers can make technology more senior-friendly. Encouraging regular use, such as checking email, making a video call, or paying a bill online, reinforces familiarity and reduces fear. Embracing even basic technological skills can significantly improve autonomy, convenience, and social connectedness. Ultimately, while adapting to technology and modern conveniences is a challenge for many seniors after 80, it is far from impossible. With guidance, practice, and patience, older adults can harness these tools to enhance independence, safety, and quality of life. Overcoming this barrier not only empowers seniors to navigate the modern world confidently but also helps them stay connected, informed, and engaged in an increasingly digital society. After the age of 80, managing finances and healthcare becomes an increasingly complex and sometimes stressful reality for many seniors. Retirement often brings a fixed income, such as pensions, Social Security, or savings, which must cover not only daily living expenses but also unexpected costs related to health or emergencies. Rising healthcare costs, prescription medications, and potential long-term care needs can quickly strain even carefully planned budgets, making financial management a constant concern. Healthcare management itself grows more complicated with age. Seniors often face multiple chronic conditions, requiring regular doctor visits, specialized treatments, and consistent medication schedules. Coordinating these needs can be overwhelming, especially when juggling insurance policies, billing, and medical paperwork. For those living alone, keeping track of appointments, understanding medical instructions, and ensuring timely medication adherence can be particularly challenging, increasing the risk of errors or missed treatments. The combination of financial and healthcare pressures can create significant stress. Anxiety about affording medical care or fear of running out of funds may lead some seniors to delay necessary treatments, skip medications, or limit their daily activities to save money. This can negatively affect health outcomes and overall quality of life. Additionally, seniors may worry about becoming a financial or caregiving burden on family members, which can further intensify emotional stress. Planning and proactive management are key to mitigating these pressures. Seniors can benefit from reviewing their financial situation regularly, working with trusted advisors, and exploring options such as insurance coverage, government benefits, or community assistance programs designed for older adults. Simplifying finances, setting up automatic payments, and maintaining organized records can reduce confusion and stress. On the healthcare side, maintaining an organized schedule of doctor visits, medication routines, and preventive care is essential. Utilizing reminders, pill organizers, or digital health tools can help seniors manage their treatment plans effectively. Open communication with healthcare providers, family, or caregivers ensures that medical decisions are informed, coordinated, and aligned with the senior's preferences and needs. While financial and healthcare management pressures are a reality after 80, taking proactive steps can preserve independence and peace of mind. Seniors who plan carefully, seek support when needed, and stay organized can reduce stress, maintain their health, and enjoy a higher quality of life. Awareness, preparation, and consistent management turn what could be overwhelming challenges into manageable aspects of aging gracefully. One of the most painful realities seniors face after 80 is coping with the loss of peers, friends, and loved ones. By this stage of life, many have experienced the passing of spouses, siblings, and close friends. These losses are not only emotionally taxing but can also have profound effects on mental health, daily routines, and overall quality of life. Grieving becomes a recurring process, as seniors confront the absence of familiar faces and the shrinking of their social circle. The emotional toll of loss often goes beyond sadness. Loneliness, anxiety, and even depression are common reactions. Seniors may feel a sense of emptiness or fear of being left behind, especially when their support network diminishes. Losing companions with shared memories can amplify feelings of isolation, as cherished moments and experiences can no longer be revisited in person. These emotional challenges may also affect motivation and engagement, making everyday tasks feel heavier and less meaningful. Grief after 80 can be particularly complex because it may coincide with other age-related challenges. Physical limitations, chronic illness, or cognitive changes can make it harder to cope with emotional stress, and seniors may find themselves relying more on caregivers or family members for support. Additionally, the cumulative effect of multiple losses over time can lead to a prolonged grieving period, making it difficult to find joy or emotional stability. However, there are ways to navigate this emotional landscape. Acknowledging grief and allowing oneself to feel and process emotions is essential. Seniors can benefit from talking openly with family, friends, or trained counselors, helping them express their sorrow and receive understanding and reassurance. Engaging in support groups with peers who have experienced similar losses can also provide comfort, empathy, and practical coping strategies. Maintaining connections with surviving loved ones is equally important. Regular social interactions, whether in person, by phone, or through digital platforms, can counterbalance feelings of loneliness. Pursuing hobbies, volunteering, or joining community activities offers a sense of purpose and fulfillment, redirecting focus toward meaningful engagement rather than solely on loss. Ultimately, while the loss of peers and loved ones is an inevitable and often painful part of life after 80, it does not have to define a senior's remaining years. By seeking support, embracing meaningful connections, and finding purpose through activities and relationships, seniors can navigate grief while preserving emotional resilience, independence, and a sense of joy. Understanding and addressing these emotional realities empowers seniors to live more balanced and fulfilling lives despite the challenges of aging. After 80, many seniors experience a growing sense of social isolation and loneliness, which can profoundly affect both mental and physical health. As friends, spouses, and peers pass away or become less mobile, opportunities for social interaction diminish. Limited mobility, health challenges, or transportation difficulties can make attending social events or visiting family harder, leaving seniors feeling disconnected from the world around them. Even when surrounded by family, older adults may experience emotional isolation if meaningful engagement is lacking. Loneliness is more than an emotional discomfort, it is a serious health risk. Studies show that chronic loneliness can contribute to depression, anxiety, and cognitive decline, while also increasing the risk of heart disease, high blood pressure, and weakened immunity. The body and mind are closely connected, and prolonged social isolation can lead to a decrease in physical activity, poor sleep, and unhealthy habits, creating a cycle that further erodes health and independence. The psychological impact of loneliness can be just as challenging as the physical consequences. Seniors may experience feelings of sadness, emptiness, or hopelessness, often struggling to find purpose or meaning in daily life. Anxiety about being alone, fear of emergencies, or concern about burdening family members can intensify emotional stress. This can result in withdrawal from social opportunities, worsening isolation, and reinforcing negative feelings. However, social isolation is not inevitable. Proactive strategies can help seniors maintain connections and foster meaningful engagement. Regular visits with family and friends, participation in senior centers or community groups, and involvement in clubs, hobbies, or volunteer work can provide social stimulation and a sense of belonging. Even small daily interactions, like talking with a neighbor, participating in online communities, or attending virtual events, can significantly improve mood and emotional well-being. Technology can also play a vital role in bridging the social gap. Video calls, messaging apps, and social media allow seniors to maintain relationships across distances, while online learning platforms or hobby groups offer opportunities for mental engagement and social interaction. For those with mobility limitations, home visits from volunteers, caregivers, or community programs can provide meaningful human contact. Recognizing social isolation as a serious issue empowers seniors and their families to take action. By prioritizing connection, nurturing relationships, and embracing both in-person and digital engagement, older adults can combat loneliness, support mental and physical health, and continue to lead fulfilling, socially enriched lives even after 80. One of the most difficult realities many seniors face after 80 is the gradual loss of independence in daily activities. Simple tasks that were once automatic, bathing, dressing, cooking, grocery shopping, or managing medications, can become challenging due to physical limitations, cognitive changes, or chronic health conditions. Losing the ability to perform these tasks independently often has a profound emotional impact, affecting self-esteem, confidence, and overall quality of life. Physical decline plays a major role in this loss. Reduced strength, flexibility, and balance make it harder to move safely around the home or perform tasks that require coordination. Chronic illnesses such as arthritis, heart disease, or osteoporosis can further restrict mobility and energy levels, forcing seniors to rely on others for assistance. Even everyday activities like reaching high shelves, bending to tie shoes, or carrying laundry can become risky without support. Cognitive challenges also contribute. Memory lapses, difficulty concentrating, or confusion can make it harder to manage schedules, pay bills on time, or follow complex instructions for medications. Seniors may struggle with decision-making, problem-solving, or organizing their daily routines, which can increase dependence on family members or caregivers. The emotional toll of losing independence should not be underestimated. Seniors often feel frustration, embarrassment, or even guilt about needing help. This can lead to anxiety, depression, or social withdrawal, which further impacts their overall health and well-being. Maintaining a sense of control over one's life becomes a daily struggle, and the fear of becoming a burden can weigh heavily on older adults. However, there are ways to preserve independence as much as possible. Home modifications, such as installing grab bars, ramps, and non-slip flooring, can reduce the risk of accidents. Adaptive tools, like jar openers, reachers, or shower chairs, make daily tasks more manageable. Regular physical activity, including strength and balance exercises, can help maintain mobility and prevent falls. Cognitive exercises and mental stimulation can improve memory and problem-solving skills, reducing reliance on others. Support systems play a crucial role as well. Family, caregivers, and community services can provide necessary assistance while encouraging autonomy. Meal delivery, transportation services, and in-home care can help seniors meet their needs safely without completely sacrificing independence. While the loss of independence is a reality for many seniors after 80, proactive measures, supportive resources, and adaptive strategies can help maintain autonomy, dignity, and a sense of control, allowing older adults to live fulfilling and self-reliant lives despite physical or cognitive challenges. As seniors cross the age of 80, cognitive changes become increasingly noticeable, affecting memory, attention, and decision-making. While mild forgetfulness is a normal part of aging, more pronounced memory lapses, like misplacing items frequently, forgetting appointments, or struggling to recall names, can significantly impact daily life and independence. Cognitive changes are influenced by multiple factors, including natural brain aging, reduced blood flow, hormonal changes, and long-term health conditions such as diabetes, hypertension, or heart disease. Memory decline often begins subtly. Seniors may experience slower information processing, requiring more time to recall facts or learn new skills. Multitasking becomes challenging, and complex problem-solving may take longer. These changes can be frustrating, leading to stress, anxiety, or even depression, which in turn can worsen cognitive performance. Some seniors may also face difficulties with short-term memory, while long-term memories often remain intact. This uneven pattern of memory loss can create confusion, misunderstandings, and reduced confidence in managing daily activities. More severe cognitive decline, such as mild cognitive impairment, MCI, or dementia, affects a smaller but significant portion of those over 80. These conditions can interfere with everyday tasks, including managing finances, cooking safely, or taking medications correctly. Early recognition is crucial. Noticing changes in memory, orientation, language, or problem-solving allows for timely evaluation and intervention. Healthcare providers can recommend therapies, cognitive exercises, or medications that may slow progression and improve quality of life. Despite these challenges, cognitive decline is not inevitable or uniform. Regular mental stimulation, through reading, puzzles, learning new skills, or social interactions, can strengthen neural pathways and support brain health. Physical activity is equally important, as it improves blood flow to the brain and reduces the risk of vascular-related cognitive issues. Maintaining a balanced diet rich in antioxidants, omega-3 fatty acids, and essential nutrients also supports cognitive function. Social engagement plays a critical role. Interacting with family, friends, or community groups can prevent isolation and provide mental stimulation that preserves memory and cognitive abilities. Ultimately, understanding and addressing cognitive changes allows seniors to maintain autonomy and dignity. Recognizing early signs, seeking professional guidance, and adopting preventive strategies can slow cognitive decline, enhance daily functioning, and improve emotional well-being. While memory challenges are a common reality after 80, with awareness, support, and proactive measures, seniors can continue to enjoy a mentally active, independent, and fulfilling life. After the age of 80, the risk of developing chronic illnesses rises significantly, making health management a central concern for seniors. Chronic illnesses, such as heart disease, diabetes, hypertension, arthritis, osteoporosis, and respiratory conditions, are long-term health issues that often require continuous monitoring, medication, and lifestyle adjustments. Unlike temporary ailments, these conditions can progressively affect daily life, mobility, and independence, and can increase the likelihood of hospitalizations or complications if not carefully managed. The body's natural aging process contributes to this vulnerability. Organs gradually lose efficiency, the heart and blood vessels may stiffen, reducing circulation, kidneys may filter less effectively, and the immune system weakens, making infections more serious. Metabolism slows, affecting blood sugar levels and weight control, while bone density decreases, increasing fracture risks. Even minor injuries or illnesses can have amplified consequences in this age group, highlighting the importance of preventive care and early detection. Managing chronic illnesses after 80 is often more complex due to the presence of multiple conditions, a scenario called multimorbidity. For example, a senior may simultaneously deal with diabetes, high blood pressure, and arthritis. Each condition interacts with the others, and treatments for one ailment may affect another. This requires careful coordination with healthcare providers, adherence to prescribed medications, and regular monitoring through lab tests or routine checkups. Lifestyle choices play a crucial role in mitigating the impact of chronic illnesses. A balanced diet, rich in nutrients but low in processed foods, helps maintain energy levels and supports overall health. Regular physical activity, tailored to individual capabilities, can reduce inflammation, improve cardiovascular health, and maintain joint mobility. Mental health is equally important. Stress management, social engagement, and cognitive stimulation contribute to overall well-being and can even influence the course of chronic conditions. Prevention, early detection, and proper management of chronic illnesses are vital for preserving independence and quality of life after 80. Seniors who proactively engage with their health, through regular checkups, medication adherence, lifestyle adjustments, and open communication with caregivers and doctors, can not only control symptoms but often slow disease progression. While chronic illnesses are a reality of aging, with careful attention and strategic planning, seniors can continue to lead active, fulfilling, and independent lives despite these challenges. As we age, one of the most noticeable and impactful changes after 80 is the decline in physical mobility and balance. This shift is not just about feeling slower, it affects almost every aspect of daily life, from simple movements like walking to more complex tasks like climbing stairs, bending, or carrying groceries. Muscle mass naturally decreases with age, a process called sarcopenia, making even small movements more exhausting and less efficient. Joints may stiffen, cartilage wears down, and bones lose density, all contributing to reduced flexibility and a higher risk of pain during movement. Balance, a key factor in preventing falls, also becomes compromised. The inner ear, which helps regulate equilibrium, can lose sensitivity, while reflexes slow down and vision or proprioception, the body's sense of position in space, deteriorate. Even minor imbalances that were once easily corrected can now lead to falls, which are a leading cause of injury among seniors. A single fall can drastically change a person's independence, potentially resulting in hospitalization or long-term mobility limitations. Daily routines are directly affected by these changes. Seniors may find it harder to perform activities like bathing, dressing, or reaching high shelves without assistance. Simple errands, such as grocery shopping or walking to the mailbox, can become stressful or even unsafe. This limitation often leads to a reduced willingness to move, which ironically accelerates physical decline, muscles weaken further, joints stiffen, and stamina drops, creating a vicious cycle. However, awareness and proactive measures can make a significant difference. Low-impact exercises, such as walking, swimming, tai chi, or gentle stretching, help maintain muscle strength and joint flexibility. Balance-focused activities, including specific physiotherapy routines, yoga, or even practicing standing on one leg with support, can reduce fall risks. Proper footwear, home modifications like grab bars, and maintaining an uncluttered living space are practical ways to safeguard mobility. Ultimately, while declining physical mobility and balance are inevitable realities for most seniors after 80, they don't have to mean total dependency. With conscious effort, regular physical activity, and environmental adjustments, seniors can maintain a remarkable level of independence, confidence, and safety in their daily lives. Recognizing this challenge early allows for interventions that preserve not just movement, but dignity and quality of life.